highlighting the deployment process for the Zenith Thoracic Endovascular Graft Proximal and distal components. The instructions for use booklet should be consulted for a more thorough examination of the deployment protocol, indications, contraindications, warnings, and precautions. Thanks for watching. Zenith Thoracic Proximal Component. Ensure that the captor valve is turned to the open position. Introduce the hydrated introduction system until the desired graft position has been achieved. While you constantly monitor the graft position, unsheath until the first 1 to 2 stents of the graft appear. Withdraw the sheath until the graft is fully expanded and the valve assembly with the captor sleeve docks with the black gripper. Hold the black gripper and loosen the black safety lock knob on the blue rotating handle. Turn the blue rotating handle following the directional arrow until a stop is felt. The stop indicates that the uncovered stent and proximal end of the graft have opened, and the distal attachment to the introducer has been released. Remove the introduction system entirely, leaving the wire guide positioned in the graft. Zenith Thoracic Distal Component. Position the distal component. Introduce the hydrated introduction system until the desired graft position has been achieved. Ensure that there is a minimum overlap of 3 stents. Stabilize the gray positioner and withdraw the sheath until the captor sleeve docks with the telescoping black gripper and the graft is fully expanded. To release the distal attachment, hold the black telescoping gripper and turn the black safety lock knob in the direction of the arrows until a slight click is felt, indicating that the blue rotation handle is engaged. Turn the blue rotation handle in the direction of the arrow next to label 1 until a stop is felt. Turn the gray safety lock knob indicated by label 2 on the black telescoping gripper in the direction of the arrows until a slight click is felt, indicating that the black telescoping gripper is engaged. To release the distal bare stent, stabilize the introduction system and slide the sheath together with the black telescoping gripper by holding the captor valve in a distal direction until it locks automatically into position next to the blue rotating handle. The release window on the blue rotating handle next to label 3 will turn green. Turn the blue rotating handle in the direction of the arrow until a stop is felt and the proximal end of the graft opens. Remove the gray positioner, leaving the sheath in place with the graft and wire.